Hi everyone, my name is Carissa. Welcome back to my YouTube channel. So today I actually went and took a infant CPR course, and I took a breastfeeding course and a child safety class. So I'm going to add some clips from throughout my day and what we did afterwards. If you have any comments or questions, feel free to leave them below. Thank you.
You're doing great, baby. Keep on doing it.
300 to 500 calories a day. All right, yep, you will have to consume extras, like chug some protein shakes or something. If you're like, dangerously, don't need to lose weight or you'll be like too thin or something like that. But yes, it does burn a lot of calories for everybody. Let's see, moms that breastfeed will be less likely to develop breast, uterine, endometrial, and ovarian cancers. May reduce the risk of heart disease in the mother that breastfeeds. If you're already a diabetic, it can decrease the insulin use that you will need in your life. Lowers your risk of osteoporosis, that's for everybody, all moms. And we already mentioned how it works with the bleeding. All right, so breast milk is all your baby needs for the first 6 months. So this sentence is actually a tiny bit outdated. I'll tell you what it says and then I'll tell you what the update is. So, I think 2 years ago, they made an update. So the American Academy of Pediatrics, this is their recommendation. You have to do everything exactly what they recommend. I mean, no, okay, but we'll tell you, I know what the recommendation is, like what studies have shown is safest and all that. So the American Academy of Pediatrics recommends exclusive breastfeeding for about 6 months. Then you would continue breastfeeding as you introduce those complementary foods. And then they recommend continuing breast only, but she has now said, I guess we're gonna have to give some formula because I'm in too much pain, okay? So dad is gonna give some formula, all right? So, it's happened before. The bottles of formula here in the hospital, they would be 60 ml, 60, and that would be this big. Okay, that's the 60 mark. But anyway, sometimes the baby looks to drink the entire or almost the entire bottle. People think, well, they're I guess they'll just stop sucking when they're done with the formula. No, that's not really what we go by. And so a 60, if you imagine trying to pour 60 mLs into a container that is 5, what is going to happen here? So he's most likely going to have a giant spit up, okay? 2, that stomach is not made of stone, okay? The stomach will attempt to stretch to take in the formula, which will hurt the baby. Okay, he's going to be crying, fussy, his neck, he's going to probably be spitting up like the whole rest of the day. So if we are giving formula these first few days, these numbers are important. And people might tell you a different number. This is the right one, okay?